This trial, with its preliminary exciting results, has really opened the door for looking at additional checkpoint inhibitor combination studies, and I'm very excited about the very broad landscape of trials that are going to be enrolling many more HCC patients across the world. Again, this is a very common disease. There's a tremendous unmet need for this patient population, and thankfully there's a growing library of trials, many of which may prove to be successful. So in particular, I'm certainly excited for what's now been launched as the Phase III study comparing Bevacizumab, Atezolizumab versus the first-line standard of care of Sorafenib, and that trial is currently active and ongoing and might read out in the next year or two. There are also similar studies combining immune checkpoint inhibitors with other either multi-kinase inhibitors or sort of VEGF-oriented multi-kinase inhibitors. For example, there's a trial of Pembrolizumab and Lenvatinib, which could turn out to be very exciting. There are immune checkpoints with other Immuno-Oncology agents that are being tested as well. There's a big trial of Durvalumab with Tremelimumab that we hope will be a positive study like many of the others. There are other more novel immune inhibitors, immune checkpoint inhibitors that are being combined with the standard PD-1 and PD-L1 that may also be proved to be very promising. I think overall what we're seeing is this changing landscape for HCC and patients who could benefit sometimes durably and long term. It may get to a point where the multi-kinase inhibitors actually fall further and further down in the treatment paradigm. They'll still probably be needed for some patients, but I think we'll get to the point that we're trying immunotherapy first.